So I practiced in Charleston, South Carolina, in a sea of dentists. I had sort of, probably just reading magazines, heard that cloud-based software was coming and was just hoping that there was something better than everything else I had used. When you get into the dental world, it was like everything was out of the 1980s. Buttons everywhere. All the stuff was there for you to use and do what you needed to do, but nothing was simple. When we heard about the cloud-based, that just seemed like a no-brainer. That's where things need to go. It didn't make sense to me that if you had the availability of someone else to have servers, why you wouldn't let them have servers and redundancy instead of us having one that could fail, and not to mention having an IT service and spending money on that, paying for the upgrade, all the stuff that comes along with having everything in the office. From a patient's perspective, how easy is it going to be to treatment plan, get them checked in, checked out, organize their plans, people on the books, signing up for treatment, and making it simple for us to keep a good workflow. The clinical side of the software just was simple to use and easy to understand. Easy for us, easy to train somebody to use it. And then when we got into the capabilities of the scheduling and all that kind of stuff, it was the same thing. Even after we started using Curve, we've looked at others because we never just settle for anything. We're always looking to make sure we're using the best that's out there. And we do the same thing with all of our equipment. Anything that we're doing, we should never just assume that it's always the best. And so we've looked at the competitors that have been coming along and done the demos, and just the ease of use of that side of the software. Nobody's really been able to touch that. It says a lot for Curve that we were able to go through that process and still be like, no, we still got the best thing out there.